Hi, I'm Dr. Laura Fink. I'm one of the veterinarians here at Columbia Pike Animal Hospital and Emergency Center. And today we're going to talk about senior cat care. Senior cats, when they develop arthritis, they want to be up higher, but jumping is hard. So using cat stairs to get up to the bed, a cat tree with multiple levels so they can kind of go level to level instead of making one big jump can be helpful. If you notice that your cat's having trouble getting up on things, making sure the food and the water is somewhere easy for them to get to. In the really old kitties where they're really frail, even just looking at how high the litter box edge is. Because for some cats, jumping into a covered litter box with a high side can be really difficult, and then they may not use the litter box when it's time to eliminate. Versus if you give them a litter box with a lower side, they can get into it more easily. For senior kitties, either pooping or peeing outside of the litter box is a big red flag that something's bothering them. And often it's a medical problem. So when we talk about urinating outside of the litter box, older kitties can get urinary tract infections, they can develop kidney disease, diabetes, something where either they're producing a lot of urine and they just can't make it to the box, or it hurts when they pee, and then they go, okay, well, it hurts to pee in the litter box, maybe if I pee over there, it doesn't hurt, and they tend to pee outside of the box. Some senior cats will poop outside of the box because if they have arthritis, it's uncomfortable to get into that squatting position. And so same thing, they associate the litter box with discomfort and they can poop elsewhere. It can be behavioral, as cats get older, they can get anxious, and that tends to lead to litter box problems. But particularly in an older cat, we always screen for a medical cause first, and often there is one. Older kitties, absolutely they tend to develop some kind of vision loss. The hearing isn't quite as good as it used to be. And there's nothing we can do to truly fix that. It's just age-related degeneration, in their eyesight and their vision. You can make it more comfortable for them to live with. So if you notice they tend to struggle getting around the house at night, putting in night lights can help just increase, the amount of light that their eyes have to use. When it comes to hearing loss, sometimes cats will be, either aggressive or fearful because they don't see or hear you coming, particularly if they're asleep. And that's where making sure you make noise when you approach, even stomping on the floor if you have a cat who is likely mostly deaf, lets them know that you're there so that they're not surprised when they wake up and someone's right in front of them. Older kitties absolutely can develop some cognitive decline, or dementia kind of would be the human term as they get older. Biggest things we tend to see are behavior changes. So a lot of cats will see vocalizing. At 3 a.m. they'll be walking around the house yowling, and it's particularly at night, they tend to kind of lose their sense of where everything is, and then they're anxious, and we'll use, medications to help with that. In addition, some cats will start kind of being, more aggressive with people they don't know because they're not as comfortable, they can't place themselves in their environment as well, and then they're fearful of new things. So medicating some cats can be really difficult. I had one of those cats. It can be really hard to get medication into a cat that does not want to be medicated. So often part of our treatment plan involves the question of how easy is it to medicate your kitty cat? And if it's easy, pills are often easily available, inexpensive, all that kind of stuff. Depending on the medication, many of those pills we can crush up and mix into food, mix into a flavorful liquid, like melted ice cream or tuna juice and give with a syringe. There's some medications that can be compounded into a transdermal, so essentially a gel that goes on the ear, gets absorbed through the skin. And most cats do not mind transdermal medications, so we can use those for many of the drugs we use. And then sometimes we figure out, maybe ideally this condition is treated with 4 different drugs, but we pick the 2 most important ones to make sure that those are the ones that get into the cat every single day. Kitties can live a really long time. We sometimes do see 18, 19-year-old kitties, but at some point, they really start deteriorating. And with that, sometimes there's a medical diagnosis that they have, and we know, that this is what's going to end that cat's life. This is why Fluffy's going downhill. And then we know, what do we expect? What can and can't we do about this? Also, some of these older kitties, it's 10 small things that kind of accumulate on a daily basis. And looking at overall quality of life is the most important thing. And quality of life, it's not just eating, drinking, pooping, peeing, because many cats will do that until, their very last day. It's looking at like what are things that they really liked to do when they were younger. Whether it's like laying in the sun, jumping on your bed in the morning and greeting you, eating their, little crunchy treats. And then if you're questioning things, you look at the kitty and you go, okay, how many of these behaviors are you still doing? And that tends to tell you whether they're enjoying things on a daily basis or whether they're kind of just existing but not truly comfortable. Depending on, what's going on to affect their quality of life, there's many things we can help with. We have nausea medications, we have pain medications, we have anxiety medications. And then, sometimes it's just looking at there's some good things and there's some bad things, and which one of these is more prominent on a daily basis. That lets you decide, is it time to start having some of those conversations about whether it's time for euthanasia. Say another question we get asked all the time is there's a lot of households that have 2 senior cats. So they got a kitten, they got the kitten a friend, and now they're 15, 16, and one kitty passes away, and then we have a 15-year-old cat that used to have a companion and doesn't anymore. And so often I get asked the question of like, should we get another cat? And that answer really depends on the cat. There's some cats that they don't do as well alone. They just kind of lay around. And if you get a kitten, it reinvigorates them and they're, playing and interacting again. And there's other cats that are really set in their ways and they do not want to deal with having a roommate. And so I think it's a question we run into a lot, but I also don't think there's one, kind of universal answer. It really just depends on like your kitty and knowing your kitty. I do think if we have an older cat who's used to having a companion that has now passed, a kitten is much easier to introduce to them than an adult cat because kittens, they don't care about much. They're more kind of compliant, they're more teachable, and therefore the senior cat still gets to be kind of the main cat in the household and the kitten kind of works around them. Versus 2 adult cats who both have, kind of very definitive ideas of what they want their house to be like. Cats tend to hide things, and that's where, we always say, oh, keep an eye on them at home, keep an eye out for changes in weight, changes in eating, changes in drinking. Well, some of those changes can be really subtle, or the kitty truly feels good until a disease hits a certain level of severity. And that's why the other thing we recommend to senior kitties is seeing them twice a year. Checking their weight, examining them, feeling their lymph nodes, feeling their belly. Sometimes we'll find things before the cat starts feeling poorly. In addition, checking blood work on senior kitties is really important because that's how we pick up kidney disease or thyroid disease or electrolyte abnormalities, again, before the cat starts feeling really sick. So I think having a senior wellness plan is great because then it lets you do the screening that helps keep your cat healthy without worrying about the exact cost each time. Thank you for watching this video. If you have any questions, feel free to reach out to us. We're here 24 hours a day.